What's up everyone? I want to tell you the details about how I got my teeth to go from looking like this to looking like this. So first off, I actually had traditional metal braces in high school. However, my retainers stopped fitting after a year or two. I stopped wearing it, and over 20 some odd years, my teeth gradually began to shift. And it turns out there are actually a lot of things that can make your teeth shift over time, such as clenching or grinding your teeth, pregnancy hormones, changes in your jaw structure as you age, and more. So long story short, my dentist recommended that I consult with an orthodontist, and I decided to get clear aligner treatment. You may have heard this referred to as Invisalign, which is actually a name brand. Mine were actually the 3M Clarity brand, but it's the same clear aligner technology. So how much did this actually cost? Well, you can expect to pay anywhere between $2,500 to $8,000. Mine cost $5,687.65, and that included everything. All of my visits, my final retainer, my bonded retainer, 67 aligner trays, all the attachments and everything. As far as the treatment time, it took a little over 17 months. I had a total of 67 trays, which I changed out weekly. I had to wear them for 22 hours per day, which does make eating a challenge. I would eat between 3 to 4 meals a day, and I would try to prepare my food, pop out my aligners, and then brush and floss as soon as I was done. Now, whenever I would switch to a new tray each week, I would put that in after my final meal of the day so that my teeth could adjust while I slept. Now, whenever you do orthodontic treatment with clear aligners, a lot of times they will apply something called attachments, and that's basically these little knob things you see here on my teeth. And they actually placed those attachments on my teeth during my first appointment when I got my aligners. It only took them a few minutes and didn't hurt at all. However, removing your aligners can be a bit tricky when you have a lot of those attachments on your teeth. So what I would do is either I would pry from the back and kind of stretch it out toward my cheek and lift up gently. Now, if that doesn't work because you have a lot of attachments in the front area, you can try taking your fingernails and gently pry up over those attachments and then pull off like that. And if that doesn't work, I would highly recommend a tool called the Ortho Key. I also had to wear these little elastics or rubber bands during my treatment just to help correct my bite. Now, one issue you might face if you do clear aligner treatment is the development of a lisp. And that definitely happened with me for about 3 or 4 weeks. It was pretty noticeable. And after that, it really wasn't so noticeable. Another big question that people have is, does this hurt? And the good thing about this clear aligner treatment is that they use a much gentler approach than traditional metal braces, but there is still some pain involved. The worst of it for me was definitely that first 4 or 5 days because my whole mouth completely freaked out. And I had a serious moment of regret where I was thinking to myself,
this is the worst decision ever.
But thankfully, after about 4 or 5 days, my mouth and everything adjusted, the pain began to subside, and things went so much more smoothly for the remainder of my treatment. Every subsequent tray change, which I changed them out weekly, I would get a little pain for a day or two, but then it would usually go away. Other issues that people may have with pain is that sometimes the edges of the aligners can be a little sharp and may rub up against your gums or your tongue. That was never a big issue with me. And the only other major pain I felt was when I started wearing the elastics. And what that did was it actually created some on and off migraine headaches for about 2 or 3 weeks. Some of you may be wondering how to clean your aligners, and I would simply soak them in a 50-50 solution of white vinegar and water while I ate. And then afterwards, I would just brush them with a toothbrush to clean them and then rinse them under water. Now, one issue that may come up if you have crowding like I have is the issue of polishing between the teeth. And that's a gentle term that orthodontists use. The proper term is called interproximal reduction. And what they basically do is they will take this little abrasive grinder tool and they just go up and down between the teeth, and it removes a little bit of your tooth structure. It didn't hurt at all. Now, after a little over 17 months of treatment, I went in for my final appointment where they looked at my teeth, made sure I was happy with them, they were happy with them, and then they proceeded to remove all those attachments. It didn't really hurt except a couple teeth that was a little sensitive. After that, they applied my fixed retainer, and then after that they scanned me for my nighttime plastic aligner retainer. So I'm supposed to wear my plastic retainer every night for somewhere between maybe 10 to 12 hours, and then of course I have the bonded retainer that they applied to my teeth. I'll probably have that for life, and that goes from canine to canine on both arches. And the fixed retainer really hasn't affected my speech, and it's not that uncomfortable. I've pretty much gotten used to it. So that was a little bit about my experience. Now, I've had both traditional metal braces and the clear aligners. If you asked which one I thought was best, I will tell you hands down, I thought the clear aligner treatment was way better. It didn't hurt as much because metal braces really hurt my teeth whenever they would adjust them. It's a much more gentler treatment with the clear aligners. You don't notice them as much, and you can pop them out and clean your teeth better and floss and all that, and it's much better in that sense. So overall, I thought it was a much better experience, and I would highly recommend, if you're thinking about doing it, to check out the clear aligner treatment. Okay, so I hope sharing my experience helps someone out there. If you're thinking about doing it, make a consult with an orthodontist and see what happens. Thanks so much for watching, and please subscribe.